This medication, Apri, is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Apri may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. When taking Apri, it's important to follow your healthcare provider's instructions for the daily dosage and optimal timing for taking the medication. Before starting to use Apri, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth once daily, at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and then swallow it. It is crucial to continue taking this medication exactly as prescribed by your doctor. Make sure to follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. Vomiting or diarrhea can prevent your birth control pills from working well. If you experience these symptoms, you may need to use a backup birth control method. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea. You may choose to take this medication at another time of day that is easier for you to remember, just make sure to take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication. It may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience any of the following side effects, be sure to speak with your doctor or pharmacist. These include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles or feet, weight change, vaginal bleeding between periods, missed or irregular periods, and high blood pressure. It's important to monitor your blood pressure regularly while taking this medication. Serious side effects to watch out for include lumps in the breast, mental or mood changes, severe stomach or abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes or skin, and symptoms of blood clots such as chest pain, sudden dizziness, trouble speaking, and vision problems. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. And remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. If you are over 35 years old and use tobacco or smoke cigarettes, it is not recommended to use Apri. This is because smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Apri. The risk of these serious problems becomes higher as you age and the more cigarettes you smoke. It is important to not smoke or use tobacco while taking Apri. Before taking Apri, make sure to inform your doctor or pharmacist if you are allergic to estrogens or progestins, or if you have any other allergies. It's also important to share your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol or triglyceride levels, depression, diabetes, gallbladder problems, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, this medication may affect your blood sugar levels, so be sure to monitor it regularly and inform your doctor of any changes. Chewable tablets may contain sugar and/or aspartame, so use caution if you have diabetes or phenylketonuria. It's important to tell your doctor if you will be having surgery or will be confined to a bed or chair for a long time, as this medication may increase your risk of blood clots. You should also inform your doctor about all the products you use before having surgery or dental procedures. Apri may cause dark areas on your face and skin, so limit your time in the sun and avoid tanning booths and sun lamps. If you're nearsighted or wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. After stopping birth control pills, it may take longer for you to become pregnant, so consult your doctor if you have concerns. This medication should not be used during pregnancy, and if you become pregnant, inform your doctor immediately. It may also decrease breast milk production, so consult your doctor before breastfeeding. When taking Apri, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Apri include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, certain drugs may cause hormonal birth control to work less effectively, such as griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug while taking Apri, be sure to inform your doctor and discuss if you should use additional reliable birth control. It's also important to let your doctor know if you experience any new spotting or breakthrough bleeding, as these may indicate that your birth control is not working effectively. Furthermore, Apri may interfere with certain lab tests, potentially causing false results. Therefore, it's essential to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Apri and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. If you're in the US, you can call your local poison control center at 1-800-222-1222, and if you're in Canada, you can call a provincial poison control center. It's important to seek medical help right away in case of an overdose. It's important not to share Apri with others. Make sure to attend regular physical exams and medical tests, such as blood pressure checks, breast exams, pelvic exams, and pap smears while taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Apri, refer to the product package for guidance on what to do. It is important to use backup birth control, like condoms or spermicide, to prevent pregnancy if you have missed a dose. If you have any questions, make sure to ask your doctor or pharmacist for guidance. If you find that you often forget to take your pills as directed, it may be a good idea to talk to your doctor about switching to a different form of birth control. This can help ensure that you are effectively preventing pregnancy. Remember to take Apri at the same time every day for maximum effectiveness. Make sure to store Apri at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush Apri down the toilet or pour it into a drain unless instructed. Properly discard any expired or no longer needed Apri by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.